thank you everyone for coming today. It's great that Suzanne has organised some really great speakers. We have Scott Miller from Volunteering Victoria, Professor John Catford, who is from Public Health Victoria, Dale Park, who's the Regional Advisor from the ESDT. And it's great that we can come here and get some knowledge so we can take it back to our own businesses and yeah, be better doing what we're doing. So look, thanks for coming. I'll introduce Scott first. Scott Miller is the CEO of Volunteering Victoria. He's been the Chief Executive Officer for nearly 2 years and previously was the Chief Executive Officer of Volunteering New Zealand. Scott's current focus is on supporting volunteers, Victoria's volunteer involving organisations, and to recover sustainable and safely from the COVID-19 crisis. So thank you very much, Scott, for coming. You might, yeah.
There we go. Thanks very much. Hi everyone, lovely to be here in this wet and very damp day in Melbourne. At least the birds outside look happy in their current environment. So 10 minutes, and I've been invited to speak on returning volunteers to your organisation. Just acknowledge that I'm presenting this morning from the Wurundjeri country and acknowledge any elders past, present and emerging. I'm going to share my screen here. Okay, good as gold. Okay, so I'm going to do that, and I'm just going to do this. Bear with me, sorry, technology. Okay, so here we go. So from our membership survey, maybe a month or two ago, we found that 65% of organisations have suspended some or most of their volunteers. So an incredible amount. Nationally, about 12 million hours of volunteering has been furloughed at the moment. So it's been a sizable disruption in respect to the amount of volunteering that's going on. However, as we're starting to see a slow return to down the levels, that's encouraging, and so naturally you're going to want to start thinking about your volunteers' involvement and how you can support them with that. It's been one of the biggest concerns through our membership survey is how do you retain members during this time that they've been away, and how do you engage with them, and then how do you bring them back. So this morning's presentation over the next 10 minutes or so is going to hopefully address some of the key thought points. First of all, safety is important. Rita, can you see my slides okay? Yes. You're muted.
I can see you fine, Scott, yes.
Great. Okay, safety is paramount. We all know that, and that's going to be really vital to how we manage this. Obviously, we don't want to return anybody and then have them become a vector of transmission. And in accordance with health and safety obligations in the state, we should always be thinking about reasonable steps to protect their safety all the way through. Obviously, and John will talk a great deal to this, I imagine, and that involves taking reasonable steps along the way, implementing risk assessments and effective controls, and naturally communication every step of the way. Obviously, there's a shortage of PPE, so managing that sort of ability to be aware of what's available and what isn't, and how you're going to deal with that is going to be important as well. So step one, keep up to date with what's going on both on the Vic State Government website. Have a look at our website, volunteeringvictoria.org.au. We've got some really great resources for leaders of volunteers, and we're just in the process of turning what is this PowerPoint presentation into its own standalone resource, as well as a couple of checkpoint lists as well to help you evaluate these steps in your own journey. Noting that also Safe Work Australia has done a really great checklist as well. So we encourage you next to evaluate the impact of any changes that have been made to your operations as part of responding to COVID. Has there been a loss of capacity, and what restrictions remain in place that may affect your operations? Obviously, if you're in community transport, how are you going to then consider spacing? How are you going to consider the handling of some of your patients or clients or what have you? How are volunteers going to be involved in that? to consider what is going to be the impact on a day-to-day basis there. Next, really, it's going to be important to bring along with yourself the leadership of your organisation and the board. They're going to have a pretty clear need to understand what is the status quo, what is going to be modified, what is going to be amended to make sure that your organisation is considering all the changes that are going to be required to bring in volunteers. So again, thinking about what are the things that you're going to mitigate in the short term, in the medium term, and then over the long term is going to be vital to how you are working. So getting to the rub now. Obviously, redesigning a volunteer program is going to require a little bit of consideration. Talk to your volunteers. What can they suggest that is going to perhaps be something that might be in your blind spot on how you're going to eliminate any issues or support people that are going to have residual concerns. From people that I've talked to, there's a great deal of concern about being around potentially COVID-related people and also being responsible for any potential transmission. So managing that subjective risk is going to be just as important sometimes, I think, as managing the objective risk. Undertaking your detailed risk assessment, getting buy-in, of course, is going to be really important. Again, I recommend that you do that by supporting volunteers to buy into the risk assessment along the way. Obviously, we are also producing a resource that considers the different levels of risk according to the different populations. And naturally, if you're dealing with folks that are a bit older, or you've got volunteers that are a bit older, and this is something I imagine John will be able to speak to a little bit more better than I will be, but how do you make sure that those that are more vulnerable are going to be better supported, recognizing that they may be both your volunteer and or your client at the same time? And we'll be developing a risk hierarchy, which we're on our website shortly, to kind of support you to manage those risks. Step 5 is re-engage and recruit your volunteers. There's been a real surge in interest from people across the community that want to be a volunteer. It's been one of the real unintended consequences of this crisis is that there've been numerous people saying, help, what can I do? And obviously, if you're going to be having to consider the risk factors of some of your volunteers, talk to your local volunteer resource centre, talk to us. We have a list of about 500 people that have expressed an interest to help with the COVID crisis, and all the time considering the psychological and physical attributes of what they need and what they think they may need to support you and your service delivery. Then finally, thinking about prioritising your programs according to resource availability and interfacing with other support organisations, maintaining what may be a hospital visit in regards to what they're going to require, and in terms of what your organisation's more general policies are recommending as well is going to be just as important. So as we come through this period, we're going to be needing to consider other little things as well, such as, will you encourage through policy that they have the COVID Safe app? Are you going to be able to kind of do regular check-ins to make sure that they are still feeling comfortable in their environment? Because this is going to be a stressful time, I imagine, for your volunteers, for those that come back tentatively and those that come back full on. So that's kind of my sort of overview in a nutshell there. I think we're going to be doing questions at the end. That's right, isn't it, Rita?
Thanks, Scott.
Questions and answers will happen at the end of the 3 presentations. So look, I'll hand over there and over to you, Rita.
Thank you. Thanks for that, Scott. That's very informative. I think it's one of the things we're all concerned about is our volunteers, how we keep them engaged, how we keep them sustained in our programs, even though some of our programs aren't going. So yeah, thanks for that. That's been great. Let me introduce Professor John Catford. He's a Professor of Public Health for over 30 years and is in Australia and in the UK. and with the World Health Organization. His current appointments include Public Health Specialist Advisor, COVID Pandemic Response, Victorian Government, Professor Emeritus, Deakin University, and there's a few other things in that. But he understands how community health and educational organisations work and how to transform them into new higher levels of performance. So we really look forward to your presentation, John. Thank you very much.
Well, thank you very much, Rita. Good morning, everyone. I have enormous admiration for the work of community transport operators. You provide a really vital service, and particularly at this time, we need your support. Clearly, you're at risk, as other people in the community are at risk from coronavirus. So what I thought I'd do is just talk a little bit about what the current situation is, and then begin to unpack some of the things you need to think about in terms of the service that you provide. Well, we're in quite a good situation now in Victoria. The higher levels of coronavirus or COVID-19 infection have plummeted, and we're pretty stable now. We've had more than 1,500 people with the disease, but the vast majority, I mean, something like 1,450 have now recovered. So that's very good news that people are getting through this and getting back to their life. But we do have active cases. We have around 90 active cases. In other words, they still have the disease, they have symptoms, and many of them, unfortunately, are having it quite bad. About 10 of those 90 are in hospital at the moment, and about 5 are in intensive care on ventilators. So they are very sick. But the message is, very fortunately, we have very low impact at the moment, and we want to keep it that way. And because of this low level, the government is now beginning to ease the restrictions, which is very good. It means we can now do the things we want to do step by step. But it does, of course, mean that the risks potentially could increase if we have a huge surge or another wave. And therefore, it's not a question of getting back to normal. It's about doing the right thing by everybody in the community, and particularly following advice coming out of public health and governments across the nation. So as you probably know, there have been some easing of restrictions just in the last few days. And in terms of the sort of work you do, people are able to leave their homes for 5 principal reasons now. I mean, you know these: to go shopping, to do essential shopping, to get medical support and care, and to access now those essential community service activities. For instance, participate in a group session, or if you have a disability, go to a disability day service. So there are critical services now that you're able to attend and participate in. You can, of course, make visits for compassionate reasons. You can leave the home for work and study. And the new one, of course, is that you can now visit friends and family, up to 5 people in a visit. But the general advice is, if possible, do stay at home. If you can work at home, work from home. So we're gradually easing, but we've got a long way to go before it's back to some sort of new normal. For obviously community transport workers and organisations, there are special risks and issues that you'll need to consider, and I'm sure you've already been doing that. There's quite a few things that we could talk about, and I'm probably not going to cover very many of them, but I'll just sort of pull out the key principles. The first one, of course, is we don't want people to work in your service or use your service who are sick, because they could have coronavirus COVID-19. So you need to be very sure that anyone who's providing the service is not sick, and that if people are sick, you need to take special precautions, passengers who are sick, and it will be preferable if they require medical attention, that, you know, potentially an ambulance could be used for that purpose. But there may be situations where you have to be involved. That's a special subset, so I'm not going to talk about that in a lot of detail. But for if you like, the general population, what we're of course trying to do is encourage high standards of hygiene and good physical separation from one from another. Now, in a vehicle, obviously that is difficult. But wherever possible, if you can encourage separation of 1.5 meters, that would be ideal. That means perhaps, you know, the driver sits in the front and the passenger sits in the back, or in larger vehicles, obviously there can be more separation. We'd like the journeys to be kept as short as possible. Clearly that reduces the exposure, and we'd like, obviously, good standards of hygiene, so there is regular cleaning and disinfecting of high-touch surfaces, so door handles, windows, those sorts of things, potentially seats. And it would be much better if the vehicle could be disinfected after each journey or after the use by each passenger. Now, I realise there may well be lots of complications here, which we could discuss in question time, but I think what you should be aiming for is the best possible options of the least risk. So separate, clean, keep journeys short. Also, you need to think about what happens before they get into the vehicle and afterwards. So we don't want people queuing densely packed in queues. We'd like them to move away quickly from the vehicle into whatever they need to do next. So I think those are some of the principles. Now, on the health department, this is the Victorian Health Department's website, there is a range of information available that begins to unpack that. And there is also a very good website available through Safe Work Australia. Now, I could share my screen with you, but I'm not sure I'm technically capable of doing that very well. I don't want to interrupt, but we might try that in a moment. But if you go onto the Safe Work Australia website, you can look for public transport or ride shares, or and there's a whole drop down menu of things to look at, for instance, hygiene, physical distancing, and there's a whole series of Q&As there that I think are really quite helpful, and we could perhaps touch on those a little later on. Something that often people get quite concerned about is whether people should be wearing masks or not. And I will just touch on that because I know that's something a lot of people raise. The view of the Australian government, that it's not necessary to wear a mask if you're healthy. That's the sort of, if you like, the official position. But of course, many people would like to go beyond that and protect themselves. So we are seeing people wearing surgical masks. That's entirely up to them. It's a voluntary activity. You can decide with your service whether you want to go down that route. There's no one saying you can't do it, but it's true to say the government's not suggesting that this is something that everyone should be doing in a taxi, bus, rideshare situation. If you do wear a mask, it's very important you do put it on properly and you take it off properly. And with the surgical mask, as we're not suggesting, anyone's suggesting you should be wearing one of these respirator masks that you'll see in, you know, hospitals, in infectious disease wards. What we're talking about is a surgical mask, which is really more of a cough or sneeze barrier to stop you passing on potential virus to other people. It's not particularly helpful to protect you from breathing in because it doesn't fit tightly and the filter isn't that fantastic, but it does provide that sort of cough barrier, that sneeze barrier. So if you do sneeze, you're not going to push the droplets all around the vehicle inside. It's going to be caught in the mask. So that's something to consider. There is information on the Safe Work Australia site that talks about this. There are shortage of supplies, so that is an aspect. You know, you may not be able to access masks, As I say, it's not something that is being recommended by the Australian government at the moment, but it's entirely up to individuals if they wish to go down that route. Well, look, there are lots of things we could usefully discuss, but I've just sort of highlighted some of the important ones. I think that the positive message, of course, is that there isn't a lot of virus out there in the community. And that's because everyone's been doing literally the right thing in trying to reduce transmission through physical distancing, good standards of hygiene, and staying at home, particularly if you're sick. So we need to keep up that. Just because restrictions are easing doesn't mean to say that it wouldn't be better to still be vigilant and attentive. Just because we can all pile into cafes and restaurants in a few weeks' time doesn't mean that we all should be doing that. And I think we all need to use our common sense, and particularly for people who are in those sort of at-risk groups. And I'm talking about people over the age of 70, people who've got a chronic medical condition like heart disease or lung problems or immunosuppressed, immunocompromised. I mean, they need to take very special care not to expose themselves. And I'm conscious that often volunteers fall into those groups. So I think it's something to think about whether or not you'll be encouraging people in the at-risk groups to be heavily involved, and whether there are ways that you can manage that to reduce their risks, so they undertake activities which would not expose them as much as you might for younger people. I think at the end of the day, it is a question of people working out the risks for themselves. Scott absolutely mentioned this importance of a risk assessment. It's a bit of a buzzword, but what we really mean is that, have a look at the service you provide, literally sort of walk through the service from start to finish, and just think about, well, if someone did have coronavirus, how could it pass on to the next person? And just think about, well, what can I do just to break it in its tracks, stop the spread? And that's really what the risk assessment is about, just thinking through all the aspects that might result in transmission, how many people, where people are congregating, how long for, what the physical environment is like, if people are using hand washing, hand sanitizing, disinfecting surfaces, and so on. I mean, I'm sure you can work through it. And as I say, there are quite a few useful guides around for you to refer to. So Rita, I think I'll stop there and be happy to take questions a little later on.
Terrific. Thank you, Professor Catford. That was really great. Great food for thought for us all. And yeah, risk assessment is a big word, isn't it? Thank you. So I'd like to introduce Dale Park. He's the Regional Diversity Advisor for the Eastern Sector Development Team. He's a trainer and activist. He's worked across the public, private, not-for-profit and sports sectors, embedding diversity and inclusion principles within organisation policies and practices to affect cultural change. He's focused on changing the conversation around diversity by moving to an asset-based approach that recognises the value difference brings to organisations and communities. He's currently working as a regional diversity advisor in the East for the community aged care sector and as a freelance consultant. He's passionate about supporting organisations to make real and lasting change, ensuring quality of access and outcomes for consumers, and building inclusive service and working environment. So I'd like to introduce Dale, who was actually instrumental in supporting Bridges to embed inclusion within our organisation. So thanks, Dale, for taking your time and coming.
Thanks for having me. And welcome everyone. I'd also like to acknowledge that I'm currently on the land of the Wurundjeri people and pay my respects to elders past, present and emerging. So I will just share my screen with you. So when I was asked to put this presentation together, what I was thinking about is what can we kind of cover in 10 minutes that is useful and maybe gives you some time to reflect and think about how you can develop and progress your services and what you're doing. So I've kind of titled it Valuing Diversity and Creating an Inclusive Environment, and hopefully that's what we're already doing, but also recognizing that there's always opportunities for us to improve and do better. So to start off with, if I think about diversity, there's lots of different ways that we think about diversity and describe it. One way that I've kind of thought about diversity and described it is looking at the personal characteristics and attributes that help shape who we are and what's important to us. So that's kind of a bit of an introduction or an overview of how we look at diversity within the work that we do. And I think it's really beneficial if we keep that in mind when we work with individuals. As Rita sort of said in the introduction, I am very keen on taking an asset-based approach to diversity. So what that means is that we don't want to see diversity blamed for people not being able to access services, and we don't want to see diversity as a negative thing. Diversity is a strength, and we need to acknowledge that and embrace it. And that's some of what we'll be going through today. So in terms of valuing diversity, how do we do that? So valuing diversity and creating an inclusive and welcoming environment is about recognizing, respecting, and drawing on the positive aspects of difference. But importantly, we need to go further than that, and we need to proactively challenge discrimination and remove the barriers that people experience. Otherwise, we're not truly valuing diversity. So we could have diversity in terms of representation, but the people may not be enjoying the same benefits from our service or our workforce. The positive steps we take to empower people and communities to be active participants and leaders is at the core of creating inclusive services and inclusive access. And I think the really key thing there for me is around, it's not just about having people be participants, but we want diversity within our leaders, within our CEOs, within our board members, within our managers, within our participants through all levels. Otherwise, it's not truly an inclusive environment that we've created. I'm now going to talk about removing barriers, and all services aim to be welcoming and create environments that make people feel comfortable and safe. However, we can unintentionally create barriers for people, reinforcing their concern that the environment or the organisation is unwelcoming or unsafe. So what we want to do, as the image showed, is remove those barriers and open the door and let them come in. But how do we do this? So if we think about community transport, for example, we may think about how people are or aren't accessing our services and the reasons why. And that really brings us to knowing our community. So in order to know our community, we need to understand the diversity and the identities of people who live in our local area, understand their needs and interests, and then find out from them why they're not using our service if they're not, if they are, what's working well, and how can we ensure that the percentage of people that are within our community are represented within our organisation and within our clients. And so there's a whole range of different ways that we can do that. If we think about community transport, we may have a particularly large demographic of a particular community living locally, but they're not using our service. So it would be really interesting and necessary to find out why they're not using that service. Do they know about it? Do they understand community transport? Have we created marketing and promotional materials that actually appeal to them, that actually speak to them? Are we creating marketing materials in languages that they can read and understand? So these are just some of the ways that we can kind of look at trying to know our community and respond to their needs. One way that, or one approach that I think we really need to adopt and put in place is what we call an intersectional approach. So you may have heard of the term intersectionality before. Now, I know it's a particularly long word, but it doesn't need to be scary and it doesn't need to be overwhelming. What intersectionality talks about is essentially, it recognizes that people are not just one part of their identity. So no one is just their gender identity, gender expression, religion and belief, country of birth, etc. But actually, they are all of these things combined. But intersectionality goes further than that. It's not just about we're made up of all these different diversity characteristics. It actually talks to how people experience unearned privilege and unearned disadvantage because of the way society is structured and provides power and privilege to dominant groups. So we've probably heard about the term male privilege and white privilege. And the reason that that has come about is because for the majority of our environments and our experiences, people who hold positions of power tend to be male, and therefore inherently men benefit and privilege from that. And equally, from a race perspective, within Western cultures, people from a white demographic have benefited and enjoyed privilege over other groups. And therefore, the way that organizations, structures, and systems have been created to benefit those individuals. So we can have all the best ideas and values in trying to create inclusive environments, but if we don't take a step back and think about it from other people's perspectives and other people's lived experiences, and think about how their diversity and identity may have unfortunately meant that they've been disadvantaged throughout their life through no fault of their own, but just because of how structures have been created, then we're actually just reinforcing that inequality. So we need to go much, much further than just having nice policies and being nice people. We need to systematically detach and remove all the barriers that people experience. So one way that I've sought to try and make intersectionality maybe a little bit more inclusive and a little bit easier to understand on a kind of graphic level is by creating the diversity jigsaw. And this is what's in front of you now, because sometimes terminology and things like that can put people off, and we don't want that, because all we're doing then is reinforcing privilege and reinforcing power and inequality. So what I've tried to do with the diversity jigsaw is show that diversity does exist within all of us. We all have these diversity pieces going on. What's important to us varies from person to person, and it really tries to show that actually just because someone is from a particular cultural background, that is not the only thing that's going on for them. All of these other things are happening as well. And it then gives us an opportunity to think about how that person or particular individuals have experienced barriers or experienced privileges and power throughout their life. And when we think about that in the current context, people who maybe have an experience of mental health problems or fear or concerns around OCD and things like that, living through something like COVID-19 could be increasingly difficult for them. So we need to take into account all those sorts of considerations when we're working with individuals and when we're kind of developing our services and responding to individuals' needs. This slide, Celebrate, Not Tolerate, and I think this is really important for me and something that I've already touched on but really want to push forward. Often we hear language around diversity, and the language, even if people are trying to mean the right thing, the subtext of it actually isn't inclusive. So we may hear things like, oh, I'm tolerant, or I accept people, but actually that's not inclusive language. And the reason that it's not inclusive is because there's a power imbalance. If I'm saying I accept you because you're a woman, or I accept you even though you are a person of this background or a person of that background, it's implying that I have power over you and that I'm in a more privileged position. So what we want to do is move from acceptance and tolerance to actually celebrate and welcome people. So I'm very conscious of time, so I will sort of end it here. I've created a number of resources around the diversity jigsaw The images that you've seen have been taken from a video that I've created called Connecting the Pieces, which is available on the web link. And I'll make sure that Suzanne has it all if she doesn't already. And in terms of, I guess, my role, and obviously I work with Rita and other providers who are Commonwealth Home Support providers in the East Metro region. There is one of me in all regions of Victoria. So if you're a funded service for Commonwealth Home Support Program, I'm sure you already know who your diversity advisor is and they're supporting you. If you're not, our resources are still out there for other people to use and take advantage of. So that's everything from me. So I'll just hand back over to Rita now.
Thanks for that, Dale. That was great. I'd like to thank all of you for coming, Professor Catford, Scott Miller, Dale, and I know that there's some questions. Jim had asked a question to Scott. I know you touched on this, but do you think that a client in the back of a sedan vehicle meets distancing requirements?
John, I'd probably prefer you answered that one if that's okay. I think you might have a little bit more of an educated opinion on that one.
Okay, Scott, look, if you can get the separation between the driver in the front and the passenger at the back, that's much better. Ideally, we were looking for 1.5 meter separation, but physically that may not be possible in a vehicle like that. In which case you have to make do with what you've got. I mean, the alternative is you don't provide that service or the passenger doesn't drive. Now, the Australian government's not recommending that people don't use ride shares or taxis or Ubers. I mean, what we're saying is that try and reduce the risk as much as possible, keep the journey short as possible. Is the journey really necessary? If it is necessary, take all the reasonable precautions. That there's no, if you like, absolute way of protecting yourself as soon as you leave your own home. I mean, there are risks around. What we're all trying to do is just reduce that risk. We're not going to eliminate it totally, but we're all trying to do the best we can to reduce the risk of us catching something or otherwise us passing it on to someone else. So Jim, I don't know if that helps you, but it's a question of really trying to minimize the situation and go from there.
Thanks for that. While you're there was another question from Lyndon for you, John. With a high number of community transport volunteers being in the high-risk category, that will create a potential resource issue as demand increases, particularly with physical distance. Would it be reasonable to suggest volunteers 70 plus fit and healthy with a flu shot could come back to face-to-face volunteering with a face mask?
Well, personally, I think yes is the answer. But you know, if they don't have to, if there's a way to not use that resource, that will be better. I mean, if there are younger people, that would be better. But if you are fit and healthy in an older age group and you do as much as you can to reduce risk, I think that's the best we can ask for. I mean, it's all a question of some sort of balance here. You know, if we all stayed at home, we'd be safe, you could say, but you know, we can't all stay at home. We all have to get out and do things. We don't want to stay at home all the time. So we're just balancing things up. So, you know, just going back to some of the things I talked about, you know, if the volunteer is in an at-risk group, we want to make sure they're absolutely protected as far as possible. If they don't need to be a driver, that will be better. If for very important reasons that service is required, then you know there has to be special vigilance. And we did talk a bit about masks earlier on. That would be an option. But as I say, the mask, a surgical mask, is not really protecting the person who's wearing it. It's actually protecting other people from you coughing and sneezing. So I think it's important to think certainly the sort of masks you can get access to are not, you're not putting a great big shield around you and the bug will never get to you. It's again reducing the risk of passing it from one person to another.
Terrific, thank you. This is a question from Lyndon again to Scott. Do you or Volunteer Victoria have a view on volunteers delivering community transport in the 50 years or older cohort? I understand some other state volunteer peaks suggest this is a major concern.
Yeah, no, that's a great question. And I'm aware of, perhaps I think Lyndon is referring to Tasmania, where we've kind of adapted their guidelines and are looking into it. Into how we kind of make them relevant to Victoria. Per the presentation and per John's comments, I think it's going to come down to what the organisation believes is in the best interest of their volunteers and of their community. And if that means that, you know, they're following OH&S procedures, they've made sure that they are doing as much as they can, then it's going to be a kind of a decision based on what does the legislation or the regulation say. And if it's permissive that happens, then that's going to be the organisation's call. I wouldn't really want to get too into black and whites of yes or no, appreciating that there is going to be some trade-offs and some things that are going to be just too hard to kind of acknowledge without, you know, all of the context. So really, if you take the risk management steps, you're following what the government says, yes, but with suitable precautions.
Terrific. There doesn't look to be any other questions there, unless anyone wants to write one in. Dale has kindly put his email address in there in case you wanted any more information, which is great. Thanks, Dale. If there's no more questions, Suzanne, if you'd like to let us know the highlight of next week. Or maybe before I do that, I should thank you very much, Scott and John and Dale, for being with us. It's been great, very informative, and it'll help us in our organisation. So thank you for taking the time to come out.
Thank you, and all the best.
If you'd like to leave, terrific. Thank you.
Oh, with just one more question, Rita. Sorry.
Oh, one more. Sorry. This is from Evelyn. Should we be asking all volunteers to have flu shots? And that's probably.
Yeah, well, yes, you should be encouraging it. I mean, that's the general advice. I mean, if we can reduce our risk of getting other things, it's going to help us. And certainly you don't want to have COVID and flu at the same time. That would be a very nasty combination. So yeah, please have your flu shots. And again, particularly for those at-risk groups, very important to have a flu shot. I had mine a few weeks ago, and lots of other people are having them as well. I think the availability of the vaccines is now better, but they are prioritized with pharmacists and GPs. So people in those at-risk categories have sort of first option.
Terrific. Well, thank you, and thanks for coming along.
Thanks,
and I'll let you leave if you need to go. That would be great. We're just going to have another highlight of what's in our next session. So thank you.
All right. All the best. Thank you very much.
Thanks. Suzanne, if you'd like to let us know what's happening next session.
Yes. Hi, everyone. Next week, we're having a special session on recovery, as I've had a lot of queries, a lot of people talking to me about how they reintroduce their volunteers back into their services and what that looks like, processes and checks that may need to be in place. So we've got on the agenda for next week Andrew Brick from Red Cross Victoria, who's going to talk about the principles of recovery. He's the acting state bushfire recovery lead and drought recovery programs coordinator in Gippsland. And we also have Emma King, the CEO of VICTAS, speaking, which is really fantastic. And she'll talk more broadly, and yeah, absolutely be a great opportunity to ask questions. And Lyndon Stevenson, who's the chair of VTCTA and also CEO for Community Transport Services Tasmania, will talk about their plans for recovery as well. So yeah, so that's actually next Thursday as opposed to every fortnight, because so many people are looking at what the return looks like from the 1st of June. We didn't want to wait until any longer.
Perfect.
So hopefully people will tune in for that. If you have any questions in advance, please feel free to shoot them through as well. They really help inform who who I look to bring into other sessions. Yeah, that's all from me. Thank you.
Well, thanks everyone for coming. See you next week.
Thanks so much, Rita.
Thank you. Bye.
Bye.